Information on the quality evidence for chiropractic care. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrative Medical, and I've been a chiropractor for about 24 years, and I've seen some pretty amazing turnarounds in our patients. And I'm a research nerd as well, on top of all that. So I know a few things about today's topic, and I hope you'll come along for the ride right now. You know, ever since the dawn of time, humans have been looking for ways to heal themselves. For a millennia, people have been relying on ancient remedies to cure their ailments. One of these ancient remedies was chiropractic care. Chiropractic care is a form of alternative medicine that involves the treatment of pain, stiffness, and other issues. So what exactly is chiropractic care? Well, the word itself means to do by hand. Chiropractic care is commonly thought to be popping backs and necks, and that's about it. But the truth is so much bigger than that. First, the popping and movement part of the profession is technically called spinal manipulative therapy, or SMT for short. And SMT has been used for thousands of years, far before any official invention of the profession we now call chiropractic. Although SMT is mostly identified with chiropractic, SMT is also used by DOs, or doctors of osteopathic medicine. DOs also perform surgery and are basically on equal footing in the healthcare field with medical doctors. So in the grand scheme of things, when we consider SMT, well, chiropractors are in pretty good company when it comes to the use of SMT. So spinal manipulative therapy is also now being adopted and used more and more by physical therapists as a tool to help mobilize their patients and get them to be more functional with an improved range of motion. They're catching up to what chiropractors have known for generations now. Chiropractic is not simply SMT, however. It's not just pop and bones. Chiropractic is actually a profession that includes many different treatments and many different modalities under its umbrella. Treatments like exercise instruction, targeted exercises, movement, strengthening, decompression for hot discs, injured discs, herniated discs, low-level laser, acupuncture, shockwave therapy, dry needling, soft tissue work, balance training, and much, much more. The history of spinal manipulative therapy, the earliest historical reference to the practice of manipulative therapy in Europe dates way back to 400 BC. It's been shown that even the ancient Egyptians used spinal manipulative therapy as well. Hippocrates himself was a proponent of spinal manipulative therapy. Hippocrates wrote of using SMT for scoliosis patients, describing a table with straps and pulleys to help treat the patient. SMT has been a very accepted and valued part of healthcare through the written history of mankind. It's only been since the 1900s that it has fallen out of favor with some in the medical profession. But with the mountains of evidence that continue to emerge favoring and bolstering evidence-based, patient-centered chiropractic care, the relationships between medical and chiropractic providers, that relationship is starting to be bridged more and more. So what is the evidence for chiropractic care? Well, look, while I could go on and on and on about evidence, remember, I'm a research nerd, this space isn't really tailored for that discussion because I think I'd lose you fairly quickly. But if you would like a deeper dive into the evidence and the research, I encourage you to buy my book on Amazon. It's called The Remarkable Truth About Chiropractic, A Unique Journey into the Research by Dr. Jeff Williams. My book is categorized by problems, and the research papers are written in a language that anyone can understand, so you don't need a PhD in research to figure out what it's saying and figure out the conclusions and how research backs spinal manipulative therapy and all the other modalities that chiropractic profession is utilizing. So outside of doing a deeper dive with my book, I think it's powerful to simply say that the world's largest medical group, right? Not chiropractic, the world's largest medical group, the American College of Physicians, updated their recommendations for acute and chronic back pain just in the last few years. And in that update, they recommended first-line treatments for acute and chronic back pain. So that means, when I say first line, that means treatments that should be tried first before moving on to medications and more invasive procedures. And those treatments include spinal manipulative therapy, exercise, low-level laser, massage, acupuncture, yoga, heat, cognitive behavioral therapy, and Tai Chi. And not only that, but a series on low back pain in the Lancet Medical Journal over in England supports the same. Also, the American Family Physicians supported the recommendations by the American College of Physicians. Consumer Reports has done surveys as well, and a Gallup polls as well, showing that chiropractic patients are more satisfied with their care, paid less to feel better, and were more likely to refer their friends and family members to chiropractors than to regular medical care for musculoskeletal conditions. It's absolutely amazing when you're going to an evidence-based, patient-centered chiropractor. It's just amazing the results you get. We track our patients through a program called ChiroUp. We follow up with them through email 30 days after treatment. And we have almost an 80% improvement rating, and that's for everything from plantar fasciitis to frozen shoulders to neck, headache, back pain. So, if you've got an 80% improvement for everything, what would the percentage be if we just looked at the conditions that are firmly in our wheelhouse, like neck, back, and headaches? Well, it'd be a lot higher than 80%. People just get amazing results. So what's the conclusion here? Why is chiropractic important? Well, SMT is not limited to just back pain. It's been shown to be effective for many types of medical issues, like helping patients get off drugs, getting more sleep, reducing pain, stress, and tension, improving functionality and strength and ability, and even improving symptoms of many chronic conditions. So SMT and chiropractic in general has been proven to be extremely effective for spinal and musculoskeletal conditions. Proper application of SMT, along with other conservative treatments we've talked about, can even help avoid surgery or can give you a faster recovery from surgery. At the end of the day, movement is healing, and motion is the lotion for the joints of our bodies, even down to the small joints of the spine. And when people have something as serious as surgery, even as extreme as a joint replacement, well, they got them up walking the halls, right? As soon as possible, rather than laying in bed. And that's because movement is healing. And movement is a big, big part of what chiropractors do. Probably the biggest part of what we do. So, come to Creekstone Integrated Medical. Let's get you moving and feeling better today. If you're from the Texas Panhandle area, or you're going to be passing through and you need to be seen and evaluated by me, just call us at 806-355-3000. Let's get you on our schedule. If you're watching on YouTube or Facebook, like, comment, subscribe, and share, won't you? That's the way we do it in social media days. There are so many people out there that we truly can help. Until next week, stay safe, and we'll see you then.